Okay, do you want to tell me a bit more about yourself?
Certainly, Seyi Ogunmekan. I've been a GP here in Stoke-on-Trent for just over 20 years. I was contacted by you a couple of years ago when you asked if I would be happy to write a chapter in your book. I was honored and privileged to be offered the opportunity. And there it is, chapter 8. Be smart, stay well.
Why I asked you, Shay, was that you're not only a GP who's extremely well thought of, but you've also been a lead for diabetes care that's kind of inspired all the other GPs in the area. And I know you've done a lot of education and training of the GPs, as well as all the work you do to help the patients look after themselves better. That's right, isn't it?
That's right, yes. I've been privileged over the last few years to have worked with quite a few of our colleagues in secondary care and to be able to provide diabetes education specifically across the Stoke-on-Trent area.
Yeah. So this book, the Be Smart, Stay Well, is obviously the whole sort of impetus of it is to help people to learn more about their condition and self-care. Is that what came over to you about the book?
Yes, I thought the book was very handy and very, very perfectly timed. So it allows me the opportunity to discuss some aspects of diabetes, the importance of self-care, and the use of some digital aids that can help in managing the condition. We do know that diabetes is rising in numbers and diabetes is associated with a couple of complications. And we also know that the NHS spends almost 10% of its annual budget on diabetes and diabetes complications. So I thought this was very, very handy. I know in the book we also consider other long-term conditions like COPD and asthma and atrial fibrillation and hypertension, but I was quite privileged to be able to contribute to the chapter on diabetes.
And diabetes is linked with some of those conditions you just mentioned, isn't it? Like hypertension.
They are, and in fact, the evidence shows that improving diabetes, i.e. the blood sugars, and improving the blood pressure will help to reduce many of the complications associated with diabetes. So complications such as eye damage, amputations, strokes, heart attacks, yes. So we know that if we can improve this, if we can improve the management of these two, the blood sugars and the blood pressure, then that can go a long way in reducing many of the complications. And so I thought in the book that I would try to emphasize that and try to bring back that to life.